Will toothache go away? And what happens if I ignore my toothache? Hi, it's Michael Ghobrial here from Shaw Dental in Brisbane at Wavell Heights. A couple of weeks ago, I met a lovely patient, Marita, from Hamilton, who'd had some chronic toothache for a long time. She came in for us to assess this tooth. She'd been to a few other practices and the pain had continued. And she asked a really great question, and it's, why doesn't the toothache disappear? Why don't your teeth fix themselves? It got me thinking about that question. I thought I'd record this video to help you understand, will toothache go away? What happens if we ignore our toothaches? At the end of this video, I'd love for you to know a little bit more about what happens to toothaches that are ignored. I guess the question, will the toothache go away? Sometimes teeth will start to be a little bit sore due to a bit of sensitivity. Sometimes it can be a change in toothbrush or toothpaste, a change in weather. It can be short-lived sensitivity to cold that is short-lasting and disappears. However, throbbing, aching tooth pain will not disappear and often will progress and become much worse. Toothaches, where a nerve has become unhappy in an irreversible manner, will continue to get worse until abscess forms. In one sense, once the abscess forms, sometimes the pain actually disappears for a while. But if it's ignored, the tooth with the abscess, one day, sometime either in the short term or in the long term, it can flare up in a really significant way that sometimes can result in facial swelling and some really unsafe health outcomes as well. So to ignore those infections is not great. Generally speaking, if you have a short, sharp discomfort like the first one I described, it's best to get that checked to make sure it's nothing serious and to make sure that nothing is going to progress, because unfortunately a toothache can progress and often teeth don't start to hurt until the issue is quite bad. But for the second thing is, if you've got a severe toothache or if you've had a severe toothache and it's disappeared, I suggest you get that checked out to make sure that there's no chronic infection that's developed there. The type of infection that is no good for your overall general health, but also the type of infection that can present in the future with quite a large facial swelling. I hope this has been helpful in helping you understand what happens to a toothache and whether they're going to go away. If you're experiencing a toothache and want to have it checked, and you're based here in Brisbane, we can definitely look after you. Simply fill in the form on our website at www.shawdental.com.au. Direct message us on social media or give us a call on 3256 9111. See you in the next video. Thanks for watching. I hope you enjoyed the video. We are regularly making new videos with tips and tricks for your dental health. So please subscribe so you can see our next video. Until then, I'll see you next time.